Our starting point today, again, is the fast-spreading Middle East Respiratory Syndrome, or MERS, outbreak, which has people in Korea on edge. Today, the country reported its first 2 deaths from that virus, and 6 new MERS cases have been confirmed, bringing the total to 25. We now connect to our Connie Kim standing by at the news center for the latest. Connie?
Well, Daniel, the rapid spread of the MERS virus is raising anxiety and putting health authorities here on high alert. Now, as you noted, Korea's health ministry reported the country's first 2 deaths from the virus earlier today. The first was a 58-year-old woman who died Monday. She was initially hospitalized for severe asthma, but doctors say her condition worsened after she came into close contact with the first MERS patient at the hospital. Until her death, she was only suspected of having contracted the virus, but testing after her death confirmed its presence. Now, the second person to die from MERS was a 71-year-old man listed as the 6th MERS patient. He was receiving treatment in an isolation ward after contracting the virus from the first patient. Now, 6 more people have been confirmed to have the viral disease, bringing the total to 25. But Daniel, what's even more alarming is that 2 people were found to have contracted the virus from a secondary infected patient. All other patients confirmed to have MERS contracted the disease from the first MERS patient.
Well, Connie, the spread of the virus has unnerved quite a lot of people here in Korea. On top of the 25 confirmed cases, there are hundreds more in quarantine, I believe.
That's right, Daniel. Korea's health ministry says more than 750 people who had contact with MERS patients are isolated in their homes or in quarantine facilities to prevent the disease from spreading. Now, the numbers are rising fast as the figure early this morning stood at 682. Now, Daniel, making things worse, the 58-year-old woman who was the first person to die from the disease in Korea wasn't under the close watch of health ministry as she didn't share the same hospital room with the first patient. Now, and in an effort to keep young people from contracting the disease, about 20 elementary schools in Gyeonggi-do province near the hospital where the 58-year-old woman was receiving treatment will be closed temporarily. And Daniel, you might also remember the person with MERS have traveled to China. Well, now he's since been diagnosed with the disease and is now under quarantine there. And Seoul-based Yonhap News Agency has reported that he has been put under supplemental oxygen, but is now in stable condition. And to prevent more MERS patients from leaving the country, Korea has placed a temporary travel ban on anyone under quarantine. Now, this is critical, Daniel, because considering Korea now has the highest number of confirmed MERS cases in Asia.
That's right. In light of recent events, Connie, the government held an emergency meeting today, and could you give us the details of anything noteworthy from that meeting?
Right, Daniel. Well, the ministers at the meeting vowed to do everything they can to stop the spread of the disease. Now, calling the spread of MERS a matter directly linked to public health and safety, the acting Prime Minister Choi Kyung-hwan said the government will mobilize the country's health and medical resources in an effort to eradicate the disease and dispel any lingering concerns about the outbreak. And from now on, all patients suffering from pneumonia and other respiratory illnesses will be monitored for a possible MERS infection. And in addition, the presidential office has put together a task force comprising officials from the Ministries of Health, Foreign Affairs, and Disaster and Safety. And they're charged with devising measures to prevent the virus from spreading further. Now, the government is moving quickly to counter criticism about its lax response to the outbreak, with the public knocking it for a late and inefficient response. Health experts have said the initial response is critical in tackling the virus, so the virus's rapid spread is a major concern as there is currently no vaccine for the illness. And while a vaccine is in development, experts say it will take years for it to be available. Back to you, Daniel.